Hello, YouTube audience. Thanks for taking the time to tune in. Please subscribe if you have not yet done so. Today, we're exploring a complex and pressing issue: recruiting health workers from the Caribbean to the United States. Our topic is the Caribbean brain drain crisis, how U.S. recruitment policies are impacting healthcare systems in the region. While beneficial for the U.S. healthcare system, this practice raises significant ethical concerns and has far reaching consequences for the Caribbean nations involved. The brain drain phenomenon. The migration of highly skilled professionals, particularly healthcare workers, from developing countries to developed nations is often referred to as the brain drain. This phenomenon has hit the Caribbean region particularly hard. According to a study by the Pan American Health Organization, about 60% of healthcare professionals still residing in their home countries in the Caribbean would migrate if given the opportunity. This statistic is alarming and highlights the severity of the situation. The impact of this brain drain on Caribbean countries is profound. It leaves their healthcare systems understaffed and struggling to provide adequate care to their populations. For instance, in 2015, 40% of vacant nursing positions in the Caribbean remained unfilled due to outmigration. This shortage of healthcare professionals can lead to decreased quality of care, longer wait times, and increased pressure on the remaining staff. Jamaica's crisis and Cuban alliance. Jamaica, in particular, has been severely affected by the mass migration of health workers. The country has faced a critical shortage of healthcare professionals, which has had devastating impacts on its healthcare system. In response to this crisis, Jamaica has had to seek alternative solutions. One such solution has been to ally with Cuba, a country known for its robust healthcare system and medical diplomacy. Cuba has been sending medical professionals to Jamaica and other Caribbean nations to help fill the gaps left by emigrating healthcare workers. As of 2025, there are approximately 400 Cuban medical staff working in Jamaica. This alliance has brought significant benefits to Jamaica and other Caribbean countries. Improved access to healthcare. Cuban doctors often work in underserved areas, providing care to communities that might otherwise lack access to medical services. Specialized care. Cuban medical missions often include specialists in fields like ophthalmology and nephrology, addressing specific healthcare needs. Emergency response. Cuban medical teams have been crucial in responding to natural disasters and public health crises in the Region 7. Knowledge transfer. The presence of Cuban medical professionals allows for the exchange of knowledge and skills with local healthcare workers. Because of Cuban medical professionals, Caribbean lives have been saved. Ethical concerns and the role of the United States. While the recruitment of Caribbean health workers by U.S. institutions helps address shortages in the American healthcare system, it raises serious ethical questions. The United States, as one of the world's wealthiest nations, has the resources to train its own healthcare workforce. By relying on professionals trained in developing countries, the U.S. is essentially benefiting from the investment these nations have made in educating their citizens. This practice exacerbates existing inequalities in global health. It leaves developing countries, which often have more pressing health needs and fewer resources, with a shortage of trained professionals. The irony is that the U.S., while recruiting these workers, often does not provide foreign aid to improve health outcomes in the same countries it's drawing talent from. Hence, these countries have to seek assistance from other countries. At times, some of these countries may be sanctioned by the USA. One such country is Cuba. The need for a new approach. Instead of proposing sanctions on countries that have lost their healthcare workers to U.S. recruitment, as has been suggested by some policymakers, the United States should focus on enhancing the healthcare systems of these Caribbean nations. This could involve investing in medical education. The U.S. could provide funding and resources to expand and improve medical training programs in the Caribbean. Supporting healthcare infrastructure, assistance in building and equipping hospitals and clinics could create better working conditions for healthcare professionals. facilitating knowledge exchange. Programs that allow for the temporary migration of healthcare workers with a commitment to return and share their acquired knowledge could benefit both sides. Addressing root causes. Supporting economic development in the Caribbean could create more opportunities at home, reducing the push factors for migration. Reflection for Caribbean leaders and the United States. As we conclude, it's crucial for both Caribbean leaders and U.S. policymakers to reflect deeply on this issue. Here are 5 questions that Caribbean leaders must ask themselves. How can we create more attractive working conditions for our healthcare professionals? What strategies can we implement to ensure a sustainable healthcare workforce? How can we leverage international partnerships without becoming dependent on foreign medical missions? What policies can we enact to encourage the return of emigrated healthcare workers? How can we balance the benefits of remittances with the need for skilled professionals at home? And for the United States, 2 critical questions to consider. How can the USA address our healthcare worker shortages without depleting the resources of developing nations? What responsibility do we have to support the healthcare systems of countries from which we recruit medical professionals? In conclusion, addressing the healthcare worker shortage is a global challenge that requires a collaborative and ethical approach. By working together and considering the long-term impacts of our policies, we can strive for a solution that benefits all parties involved and ultimately improves global health outcomes.